2% of them, the partners were located and tested. 16% of them were already knew that they are HIV positive, so they are not included here. But the 18 of those who didn't know, above 1,000 people, were found to be HIV positive. So these individuals started treatment. So it's really helpful. 1,000 people out there not knowing their status, who were really located and found to be positive, is a big number. So all I'm saying is partner services is really important, and it can help locate people and identify people and get them tested and get started with treatment. Feel free to ask any questions. You can stop me and ask any questions if you want to. But I feel bad that people don't have space. To you start with and say, how do you feel about letting your partners know about that they're exposed? So in that way, they cannot give yes or no. They're going to tell you their feelings. Because it's really important that we know where they are coming from. Because some of them may be scared of domestic abuse, because we know it can happen. Some of them may tell you that maybe their partners already has an idea and was talking about it, that maybe is not feeling good and is sickly. In that way, it's easier for them to notify them. But if you say, yeah, you want to be positive, most likely they're going to say, no, I don't. So you have to be that cool and just say, don't give them a yes or no question. Just make it open-ended. Yeah, now that we've offered all these services for you and you are doing better with your medication, what do you think about telling the people you are, in contact with that they're exposed? So you assess the situation for readiness, and again you screen for safety. If somebody tells you that my husband was talking about divorcing me, or he says that if I know that I'm HIV positive, I'm going to kill myself. So you know that you are assessing the situation and know that you're not just going to go and tell that person that, oh, we are, you're exposed to HIV. So you assess the situation before you intervene. The four partner referral options I was talking about. The first one is client referral or patient referral. It can also be called self-notification. In that way, the client agrees and or feels comfortable to tell the partner. So it's going to do the referral himself, him or herself. So when they choose to do it, that's called the patient referral or self-notification referral or client referral. Those words are using interchangeably. And again, it's when they know that, okay, maybe my husband had a herpes zoster or is having TB, and he was talking that maybe we are infected. So in that way, they kind of feel comfortable because this topic came about somehow. Or maybe some people are just confident and they feel like they can do it. I've seen some people who say, okay, I think I can tell my partner about it. So that's the patient referral. In that way, we just give them support. In this way, we coach them to look for the right place, right time, private setting where there are no people listening to bring up the topic. But the second one is called the contract referral. This one, the patient will tell you that I would like to notify the partner, but give me some time. And so they are not really sure, but they would like to try. So you make a contract with them to agree with you 2 to 3 days for the most part. In case they can't go through with it, like after 3 days, then they give you the right. It's like they are giving you a consent to go ahead and do it on their behalf. So in this, when you are doing a contract referral, or if the client selects a contract referral, you get a notebook and write down the contacts. He's going to give you all the locating information because he's trying, but he may not go through with the process. And then it's up to you. So he's contracting with you that, okay, let me try maybe tomorrow I'll try to talk to him, but in case I fail, you go ahead and do it for me. So you get all the numbers and the names, whatever information that can be helpful. Maybe they have a picture ID or photo with them, and they can give you the names and the phone number, and it's confidential. So you assure them that, okay, I'm going to be doing it in case you can't do it, but we're not going to mention your name. You can't mention the client's name, that so-and-so sent me to you that you may be exposed. No. When you do contract referral, it's just like provider referral, because the provider referral is the third one. When the client says, I cannot do it, I'll be scared, you do it for me. And in that way, they give you all the names of these individuals that they think are exposed to HIV. They will give you the name, where they work, whatever information you can get. It's the more convincing you are, the more information you're going to get from them. And again, if you assure them that you're not going to bring their name up, you're just going to go and say, okay, I'm a nurse or doctor, whatever, counselor at Nego Hospital, I need to talk to you. Sometimes they give you the phone number, but you don't tell all the message over the phone. The phone call is just to tell them that you want to meet with them face to face because of some important information. And then when you arrange on a date, that's when you tell them. And it's better if you have the testing around, because if they say yes and they're scared, you go ahead and test them and find out how they stand. The third one, like I said, the provider referral is when the client gives you full consent, gives you all the responsibility that you're going to do it on their behalf. Basically, since you have provider assistance, I know this is the service that has been missing when they give you all the full responsibility and you're going to go and look for that person on the behalf of the client. You are not mentioning the client's name, you're not mentioning the dates, you don't mention anything, you just say somebody who is HIV positive gave us your name and was at one time in relationship with you and is now HIV positive and he really cares for you. Because if somebody doesn't care, they won't even give their names. You know they care, but they're just scared. So you just tell them that, okay, this is somebody who cares about you and wants you to be tested because he or she found themselves that they are HIV positive. And in that way, that person may accept or agree to taking the HIV testing, and then you take it from there. If they are negative, you just educate them more to protect themselves, because some have seen cases where these are their husbands, their current husbands, and then they decide to do provider notification. They are still living with them, and this person is negative, and the husband is, positive. So you encourage them that even though you are negative, continue using condoms. I don't know if they offer condoms for free here, do they? Yes, yeah. So you just give them packages to protect themselves, and you can remind them that we don't give you the particular dates when you are in touch with this person. It may be current, it may be in the past. Protect yourself. That's all we can do. And dual referral is when the client has this to disclose. Is a contract, because they're gonna do it, but they may not. So they are not giving you full responsibility. The contract one, they are trying to do it themselves. So she goes to the husband and says, okay, honey, this is what, and then it changes, it gets scared. So with the contract, they may go through with it, they may not. So you call them, or they call you after whatever period you contracted. Said, I'm going to try to tell them, but in case I don't, I'll call you. So if the contract is like 3 days, you call them on the 3rd day. What happened? Did you succeed? Then they'll be able to tell you that, oh no, I couldn't. I tried and I failed. Then you kick in. That's when you get your consent. Otherwise, before the contract, you cannot do anything. Yeah. But the provider, they are not doing anything at all. They give you full responsibility from day one. They give you all the numbers and names, and you are doing it. The dual referral is when you do it both. But I'm going to bring him to you. So we're gonna do it together. He said, in case he overreacts, I don't know how he's gonna react, but I can be able to bring him to the hospital. So the dual referral, the infected person will come with a partner. He's willing and he says, I can convince him to come to you. I'll bring him to the hospital and then we can test him. So in that way, two people, like they make an appointment with the dual referral. He says, okay, I'm gonna bring my husband. I know I can convince him, maybe we have a kid and we're gonna be immunizing the kid. I'll come with him to the hospital and then we sit together. So you're expecting them to come. And he can even begin that, you know what, they tested me and I'm positive. But the nurses here can explain further, but I'm HIV positive. And then you say, you know, that's when you intervene and start answering questions, because that client will be maybe scared, but at least is bold enough to bring the person to the clinic. And then the healthcare provider will be there, the testing service, everything is there. So they are willing to bring the person to you, and whatever questions, whatever reactions, you're gonna be there for backup. So those are the 4 options. Self-notification, like we said, the partners, although many clients find it to tell the person you live with that, oh, I'm HIV positive. And again, the one by providers is the most effective one, according to the site. The one that's by providers is most effective. This one has, you know, risks involved. Again, there's no guarantee of anonymity, because you're gonna be telling them so they know you are the one who, in case they are positive, they're gonna blame it on you. But some people still agree, and it's our job to give them this option. Because if they wanna do it, then go ahead and do it. And there we don't do anything apart from coaching them, you know, how to start the conversation. Maybe I'm from the clinic and I was found to be HIV positive. So you just kind of lead them to how to do it. But again, you tell them the risks that you can tell your husband, and then he's going to tell his mother, and the mother is going to tell the whole village that you killed the son, you know. So they have to know that this one is not protecting you, is not protecting them, and but they have a right to go ahead and use it. And some people have, because this has been the one we've been telling them from day one. So some people have been successful with it, but others have had negative effects. Yeah, so here is just, you still, although they are choosing their patient referral or self-notification, you still talk to them and assess, you know, for domestic violence, do you think you're going to be hurt? You kind of talk to them, and then again, you tell them not to wait until next year. Because they can say, okay, I'm going to do it, but then it's your job to encourage them, because the earlier the better. The earlier the better, and if they push it, keep on pushing it further and further, you know, it's gonna, by the time the partner is diagnosed, it's gonna be at 8th stage. So again, you tell them that although you are doing it, please let the partner know that it's important that they get tested. Yeah, tell them the risks, you know. So you kind of just coach them and